Hi, my name is Ashley Sachs, and this is my presentation on adolescent obesity. Adolescent obesity is defined as having a body mass index percentile greater than 95% when plotted on the CDC growth chart. Adolescent obesity is a significant problem because it has been steadily increasing for the past 30 years. If a child is obese between the ages of 12 and 18, they have a 60% greater chance of becoming obese as an adult. They are also at much higher risk for numerous comorbidities, such as heart disease, sleep apnea, type 2 diabetes, hypertension, metabolic diseases, fatty liver, and orthopedic problems. The first study conducted was a randomized control trial to determine if the addition of motivational interviewing on adolescent obesity treatment improved adherence to the treatment program, thus encouraging healthy behaviors. Patients were randomly assigned to either the control group utilizing just the obesity treatment, which consisted of meeting with a dietitian, exercising 3 times a week, and a behaviorist, or the intervention group, which added motivational interviewing, consisting of 2 meetings during the duration of the 6-month program. A sample of 99 patients were recruited and randomly split into the 2 groups. Participants' adherence to the program was monitored throughout the study. Percentage of visits attended in each area was calculated to establish treatment adherence, and then a total adherence percentage was calculated. Study findings showed that at the 3-month mark, participants in the intervention group had a greater adherence percentage, 89% versus 81%, and at the 6-month mark, participants in the intervention group still had a greater adherence percentage, 84% versus 76%. It can be concluded, based on the results of this study, that MI enhanced adherence to the obesity intervention. The second study conducted a randomized control trial to see the effect of adding 2 sessions of motivational interviewing, in addition to a standard weight loss program on physical activity in obese adolescents over a 6-month period. Patients were randomly assigned to either the control group, which was the standard weight loss program alone, or the intervention group with the addition of motivational interviewing. The sample size was 54 obese adolescents. Physical activity and BMI were assessed at baseline and at the 6-month mark. The intervention group was found to have a greater reduction in BMI at the 6-month mark and a greater increase in physical activity. The synthesis of this literature can be used to support improved nursing practice by providing nurse practitioners with a very cost-effective method to use to help adolescents become healthier. Anyone can be trained to use motivational interviewing. There are numerous positive effects that would benefit nursing practice, such as reducing the number of adolescents with chronic illnesses, increasing adolescents' quality and quantity of life, fewer childhood illnesses, healthier, happier children, and positive psychological effects on the adolescents. The intervention proposed to change this area of nursing is motivational interviewing. Motivational interviewing is an effective strategy to support people in making a behavior change. It is a method of communication using core skills that engage participants in a reciprocal conversation. It includes 4 components: engagement, focusing, evoking, and planning. It strengthens a person's own motivation and commitment to change. Anyone can be trained in this, and it is very cost-effective to use in practice. The best environment for motivational interviewing to be conducted in is the outpatient clinic setting. It is perfect for anyone who sees adolescent patients to use. The study showed that it can be effective in visits as short as 20 minutes. It also only requires 1 visit every month or every other month to still be effective. Because of this, it is a great solution for nurse practitioners to use in the outpatient clinic setting.